Disease is PKU, or scientifically named phenylketonuria, a birth defect that causes an amino acid called phenylalanine to build up in the body. While the U.S. screens newborns for PKU, most countries don't. Untreated PKU can lead to brain damage, intellect disabilities, behavioral symptoms, or seizures. Treatment includes a strict diet with limited protein. A description of PKU: signs, symptoms of disease, what it's like to have the disorder, what problems are associated with are a musty odor in breath, skin or urine caused by too much phenylalanine in the body, neurological problems that may include seizures, skin rashes, fair skin, and blue eyes because phenylalanine can't transform into melanin, the pigment responsible for hair and skin tone, abnormal small head, hyperactivity, intellect disability development, behavioral emotions and social problems, psychiatric disorders. PKU can cause intellect disabilities. However, PKU does not shorten life expectancy with or without treatment. Newborn screenings for PKU is required in all 50 states, though. Each year, 10,000 to 15,000 babies are born with the disease in the United States, and phenylketonuria occurs in both males and females of all ethnic backgrounds, although it's more common in individuals from the North European and Native American heritage. PKU is inherited in families in an autosomal recessive pattern. Autosomal recessive inheritance means that a person has two copies of the gene that is altered. Usually, each parent of an individual who has PKU carries one copy of the altered gene for each parent. PKU programs is the biggest program helping to raise awareness for PKU. There is no local treatment center for PKU, but it is screen tested in the U.S. at birth for every child. Some support groups are National PKU Alliance, Children's PKU Network, National PKU News, PKU Toolkit, National Society for PKU, PKU Worldwide Support Groups, PKU National Association, and more. Also, various country-specific support groups, and National PKU Alliance is the national foundation for PKU. There are various virtual events being held for PKU because of coronavirus, and PKU Awareness Day is year-round on June 28th every year. There's no cure for PKU, but treatment can prevent intellectual disabilities and other health problems. A person with PKU should receive treatment at a medical center that specializes in this disorder. Roughly 16,500 people living with PKU in the United States today. If untreated, PKU can lead to irreversible brain damage and marked intellectual disabilities beginning within the first few months of life. Neurological problems such as seizures and tumors. The damage done to the brain if PKU is untreated during the first months of life is irreversible. For spreading awareness is a social media post and awareness video given by the PKU Alliance for the social media post, and on PKU Awareness Day to be hosted on national television where individuals with PKU can share their stories about how it's affected their lives. My case study is on Katie, a 7-year-old who has phenylketonuria or PKU, a rare genetic disease in which the body cannot metabolize protein properly. Many in the world who are born with PKU are diagnosed at birth. Because of newborn screening, they are immediately put on lifelong treatment and are able to live normal and productive lives. Katie was not given this opportunity, though. She was born in Mexico, and at the time, newborn screening was not required. Katie's parents searched for answers for months. After noticing their daughter was experiencing unusual problems, she was eventually diagnosed with PKU at the age of 13 months, but the months without treatment took a toll on her body. 7 years later, she has severe developmental delays. Katie is unable to share her story in her own words, but her parents speak up to her to share her story and promote newborn screening across the world.